Hey everyone, welcome back to Arslan's Medicine. Have you ever had that terrifying moment where it feels like the entire room is spinning even though you're standing perfectly still? Maybe you've experienced that sudden nauseating dizziness that makes you grab onto the nearest wall, or that weird loss of balance that comes out of nowhere. That's vertigo. And today I'm sharing you 4 medically proven treatments that can stop vertigo fast and help you get your life back on track. First, let's quickly break down what's actually happening in your body when you get vertigo. Isn't a disease itself, it's a symptom. The most common cause is something called BPPV, or benign paroxysmal positional vertigo. I know it sounds complicated, but benign means it's not dangerous. Basically, you have tiny calcium crystals in your inner ear, think of them like little pebbles, that can get knocked out of their normal position. When these crystals move to the wrong spot, they confuse your brain about where your body is, and that's what creates this intense spinning and swaying sensation. Let's jump right into the most effective treatment, which is considered the gold standard for BPPV, the Epley maneuver. Research shows this technique works for about 90% of cases, which is seriously impressive. Here's how you do it. Sit on your bed and turn your head 45 degrees toward the ear that's affected. So if your right ear is a problem, turn your head right. Then lie back quickly while keeping your head in that position and stay there for 30 seconds. Try to stay still even if it feels uncomfortable. Next, turn your head 90 degrees to the opposite side without lifting it, and hold for another 30 seconds. Then roll your whole body onto your side in the same direction your head is turned and hold again for 30 seconds. Finally, slowly sit back up. What you're doing is literally moving those rogue crystals back to where they belong in your inner ear, stopping the spinning sensation. The second treatment I want to share is the Foster half somersault maneuver, which is awesome for doing at home, especially if the Epley is tricky to do by yourself. Here's how it works. Start by kneeling and looking up at the ceiling. Then put your head on the ground like you're about to do a somersault. While your head is down, turn it to face the affected ear. Next, raise your head up to back level, keeping it turned. And then finally, raise your head all the way upright. This technique also helps reposition those crystals, but with less risk of feeling nauseous during the process. Now, the third treatment might surprise you. It's acupressure. Recent studies have shown that pressing on specific points can help reduce vertigo symptoms. There are 2 main points. The PC6 point, which you find by measuring 3 fingers below your wrist crease, right between the tendons on the inside of your forearm, and the GV20 point, which is at the very top center of your head. Applying firm, steady pressure to each of these points for about 30 seconds. This can help calm your inner ear and reduce that dizzy feeling. The fourth treatment is the Samant maneuver, another effective repositioning technique. Here's how to do it. Sit upright and turn your head 45 degrees away from the affected side. So if your right ear is the problem, turn your head left. Quickly lie down on the affected side and hold for 30 seconds. Then in one smooth motion, move to the opposite side without changing your head angle and hold for another 30 seconds. Finally, slowly return to sitting. This maneuver is great if the Epley doesn't work for you or if you find it too difficult. It's really important to know when you need to see a doctor. If you have a severe headache with your vertigo, hearing loss, or ringing in your ears, weakness, numbness, trouble speaking, a fever, or if your vertigo lasts more than a few days, these could be signs of something more serious. A few pro tips for ongoing management. If you're low on vitamin D, taking supplements can actually reduce vertigo attacks. This is backed by research. Stay well hydrated, avoid sudden head movements, and try sleeping with your head slightly elevated on an extra pillow. And if vertigo is a long-term problem for you, vestibular rehabilitation therapy, a specialized type of physical therapy, can be incredibly helpful for retraining your balance system. So here's what I recommend. Try these maneuvers in order, starting with the Epley. If that doesn't work or feels too uncomfortable, go for the Foster or Samant techniques. Most people feel better within just a few minutes of doing this correctly, though you might need to repeat them a few times. The key is to move slowly and don't get discouraged if it takes a couple of tries. If this video helps you understand vertigo better, or you think these techniques could help someone you know, hit that subscribe button for more evidence-based medical content. Drop your questions in the comments if you want a separate video demonstrating each maneuver, or if you want to know more about home remedies versus medications for vertigo. Stay safe, and I'll see you in the next video.